Okay, Zipporah Long is a medical doctor at Baylor Scott and White Health Primary Care in Denton, Texas. We have a patient whose name is Jackie Johnson. Her patient ID is 650032. Her date of birth is November 9th, 1967. Her today's date is July 15th, 2019. She has no allergies. And her case history reads as follows. A 51-year-old African-American woman. She is reporting hyperpyrexia, arthalgia, and dermatitis. Her past medical history included her having strep throat about 10 years ago. She eventually begins to have heart problems, shortness of breath, and fatigue, and angina pectoris. Her vital signs is temperature of 103 degrees Fahrenheit. Her pulse is 116 beats per minute. Her blood pressure is 130 over 82 beats per minute. Her weight is 145 pounds, and her height is 5 feet. The clinical impression is an improperly treated strep throat, which caused her symptoms leading to rheumatic fever, hence the joint pains. Exams used was a chest x-ray, electrocardiogram, and an echocardiogram. We found that she had tachycardia, thick calcified atrioventricular valves, which eventually led to carditis or valvular heart disease. A preoperative diagnosis was a valvular heart disease. The procedure included a valvuloplasty, and the procedure will be where the patient is placed supine in the supine position. A catheter with a balloon on the tip of it is induced into her right artery in the arm and into the lateral side of the right atrium to eventually lead to the bicuspid valve. The balloon is then inflated to expand the valve that has a stenosis going on with it, and then it's deflated and then carefully removed from the left and right atrium. The skin is then closed with a subcuticular stitch. The final diagnosis was a heart valve stenosis. Valvuloplasty was done. She has a chronic valvular heart disease in the bicuspid valve. The patient is then discharged on July 15th and she is to get follow-up instructions with Dr. Preemy, as stenosis may arise again after the procedure, and also weight gain is possible. So we recommend the patient to stay away from unhealthy foods such as glucose, pork, and things as such, sodas and things like that, and to get physical activity in as much as possible, and manage her stress, and to avoid tobacco use. And that is all.